Now, I want to talk about birth control on a general
Yes.
level. Are there any new birth controls out there, any new advancements that have been happening in the birth control world?
So I think that we're seeing long-acting contraception, for example, patch or implants, and also vaginal ring that's coming into the market. There are also new oral contraceptive pills specifically targeting conditions like endometriosis. And I believe that there's a new female condom that's also become available. So those are some of the movements forward.
And how would you recommend someone choosing the right contraception for them?
It depends on what the woman's looking for, what her medical history is, what her tolerance is, and if there are any other benefits that she would be wanting. So, I mean, as I alluded to earlier on, if she would like an oral contraceptive pill, and she's also concerned that she has increased hair growth or acne, then she might want an anti-androgenic oral contraceptive pill. The benefit of the oral contraceptive pill is it's rapidly reversible, so she can take it and then stop and try and conceive straight away afterwards. But she needs to take it every day.
Yeah.
So for those people that don't like taking something every day, a long-acting contraception is favorable, whether that's something placed in the uterus like an intrauterine device, the copper intrauterine device, or the levonorgestrel intrauterine system, or that could be an implant or a patch. Those are long-acting, so she doesn't have to think about it.
And then what happens if she decides she wants to try and have a baby? Then what happens if she's on a long-acting form?
So it depends which form she's on. The intrauterine device is removed in the procedure room, in the side room in a doctor's practice, and she could conceive afterwards.
Okay.
There is a more rapid return to fertility with oral contraceptive pill, but all of these are relatively rapidly reversed. So within 2 to 3 cycles, she could be conceiving.
So for anyone out there who's worried about Diaz or was put off by the recent reports that have come out, what advice do you have for them?
So I think that there is a concern, and having a deep vein thrombosis and the complications of that is obviously frightening for anybody. But it needs to be seen in context or in perspective. The risks were of 9 to 12 cases per 100,000 women who are using this form of oral contraceptive pill annually.
Wow.
And the risks related to unplanned pregnancy and termination of pregnancy is much higher than that. In fact, even the risks of smoking is higher than using one of these oral contraceptive pills.